If your child is active in sports, glasses can really get in the way. That happened to Janie, who is a competitive swimmer. Dr. Julio Arroyo from Eye Health Consultants has a way to help kids see clearly without the use of glasses or daily contacts. And he joins us right now along with his patient. Morning.
Good morning, Deborah. How are you? Good morning, everyone.
Good. All right. So interesting. A lot of kids are having eye problems more so today than ever before. Myopia, you say, is almost an epidemic. And if you don't address it, it just gets worse over time, especially when you're wearing glasses, as a child. Do we know why?
Well, that's exactly correct, Deborah. As a matter of fact, in 2030, it is estimated that 40% of the young population will be myopic. We know that, well, there's a number of factors why it happens, but the truth of the matter is that there's some modifications, there's some physical drastic changes that happen in the eye during these years when you are a myope. And basically what happens is that the eye stretches. The axial length of the eye, front to back, gets longer and longer. That has many implications when you're older that are actually more serious than just the fact that you have to wear glasses, such as, imagine this. If you're 5-6 diopters of myopia when you're older, that means you are 100 times more likely to develop a retinal detachment. Oh. What is critical to understand for parents is that if your kid is myopic, there are ways now to effectively slow down or even stop that progression, not just because that's better for them if they're not going to become blinder, but because you're protecting their visual future from having conditions that are much more serious, such as glaucoma, macular degeneration, retinal detachment, cataracts, and others.
Yeah, we're going to talk about that in a second. It's called corneal molding. We'll talk about how that works. But Janie, for you, your vision changed almost every time you got a checkup to the point that it was just getting worse.
Mm-hmm. It was pretty bad every time I went in. It just kept getting worse and worse and worse.
Yeah. Well, as a competitive swimmer, what was it like trying to figure out how to have vision, and how bad was your vision when you were swimming?
It was 2200, and I just couldn't focus on my swimming. I just had to focus on my contact not falling out or moving. But since I started wearing the contacts, I've just done much better.
Yeah, because you also had prescription goggles at one point, right? And so instead of the prescription goggles, what was wrong with those?
I had to wear them all the time, and if you wear them all the time, they put marks on your eyes and they hurt your eyes.
All right, so Dr. Arroyo, Janie is wearing corneal molding, which is also what I wear. Tell us how this works.
Yes, like you very well know, Deborah, this is I'd like to say it's a halfway in between contacts and surgery, because you can see with your naked eyes, but you don't have to have surgery. But in order to do that, we use these corneal, very neat devices that look like a fancy contact lens that you wear while you sleep, that recharges the batteries of your eyes, so to speak. So during the day, you don't have to wear anything. What these devices do is to modify the corneal shape. It redistributes tissue in such a way that it affects the refractive status of the eye, so it effectively puts the focus what it's supposed to in the back of the eye, so you are naked eyes, you can see clear. For youngsters, it's just a beautiful way to practice sports, do everything like if they didn't have any myopia or any refractive error. But not only that, but it protects the visual future, because you are doing a lot to, just because of the way the image focuses on the retina, we're able to slow down, even stop that progression of myopia, and that's beautiful. Of course, for adults, it's very convenient, like it's your case.
Yeah, and in my case, I had trouble seeing close up. I couldn't see that small print anymore. And so I put the contact in or the corneal mold in when I go to sleep. I wake up, take it out, and I see perfectly. LASIK is one of those things that kids can't qualify for LASIK, right? So that's not even an option for them.
Right. Well, LASIK is only approved for individuals that are adults where the prescription is stable, and that usually happens after 21, 23 years of age.
And for kids, it can treat farsightedness and nearsightedness. And Janie, so what's it like now when you're swimming and you wake up in the morning? And tell me about that first day that you woke up in the morning, took your contacts out, and then you could see.
I was so happy. I shouted for joy, and I could see everything so clearly.
Yeah. And Dr. Arroyo, like it could be 20/20 vision, 20/15 vision.
That is correct. And it doesn't take long at all. I mean, after the first night, many individuals that have prescriptions that are reasonable, under 3 diopters, under 4 diopters, they are very close to 20/20. It may take a few days for them to really, to fit in, to get adapted, for the brain to click in, if you will. But it is a very, very, very fast process. I mean, many patients, they get dispensed in the office. We tell them what they are supposed to do. They wear them for an hour. By the time they take them out, they can already see 3-4 lines better, sometimes 20/20.
Yeah. All right. So who's a good candidate for this?
Well, anyone that has healthy corneas in between 7-8 years old of age, all the way up to our, more mature person, we have patients that are in the 70s. As long as they have regular corneas that are healthy, you can do it. And it applies for hyperopia, myopia, and astigmatism. There are, of course, some individuals what is very hard to do because they have certain mixed astigmatism, but it's a very, very large range. And remember, this is non-surgical. This is not going to cause any corneal damage that is permanent of any kind. So really, there's no brainer for many people.
Yeah, and the cost?
The cost. So there are different levels of complexity. It always starts in between $1,500 and $1,800. Can go all the way up, and it depends where you go. You can go all the way up to $4,000. We never charge such a thing, but there are many plans available. Payment plans. We have inside, in-office financing, and pretty much everyone qualifies. So it is. Think about this. Let me just finish by saying this. Every daddy understand, every mommy understand that if their kids have crooked teeth, they're going to take him to the dentist because that's unacceptable. How come it is acceptable that these kids are becoming blinder every year? Well, you can stop that from happening. You can liberate your kids from getting glasses, improve their self-esteem, improve their sports and performance, improve their quality of vision. All of this for less than half what those braces cost.
Yeah,
so
it's your eyes. You're absolutely right, and I can attest to the fact that I can see now. All right, Janie, when you are at the Olympics one day, don't forget us at Great Day Houston.
Okay.
All right, Dr. Arroyo, thank you very much. Eye Health Consultants has a special offer for Great Day Houston viewers. You can get $300 off corneal molding when you call now, but you must be one of the first 25 callers. Call them at this number. It is 281-419-3355, 281-419-3355. Be sure to mention Great Day Houston. And for more information on Dr. Arroyo and corneal molding, log on to sleepnc.com.